Hello, myself Hani Mehta. I am a 4th year BPT student, role number 1, Physiotherapy in Orthopedic Condition. Today, my topic is clinical presentation of the osteoarthritis. So, let's start with the video. Let's start with the introduction of the osteoarthritis. It is defined as the degenerative non-inflammatory joint disease characterized by destruction of the articulating cartilage and formation of the new bone at the joint surface and margin. Osteoarthritis affects in the synovial joints. It is more common in the weight-bearing joint like hip, knee and spine, etc. The primary symptom it is a pain due to the nerve endings which can be present involve the cartilage, joint capsule, tendon, ligament and surrounding muscles as well as the bone. The pain in the joint is increased whenever weight is bare or when there is a motion of the joint. It will relieve by the rest. It will become a constant in a later of stage. The pain on slight movement to or minimum weight bearing which can lead to limitation in the joint of motion. When we go for the pain assessment, the type of pain are mechanical, stabbing, hitting. In the later on stage, it will become a diffuse or sharp. Onset is gradual. Aggravating factors are during activity, relieving factor during rest. In advance, there is a muscle spasm that accompany the pain and this is not relieved by the rest. Pain can be awake the patient at the night and cause discomfort for even whenever the patient is not bearing the weight. Joint stiffness. Morning stiffness of the short duration of around 30 minutes is seen in this inflammatory joint disease. Reduce in the range of motion affecting the daily activities of the occupation and social life. It is due to the capsular thickening and bony change in the joint or the muscle spasm or the joint stiffness or contractures. Tenderness. The low-grade inflammation is seen in the joint cavities, bursa and tendon sheath leading to tenderness and the pain. In the osteoarthritis of the knee, it may be present in the medial aspect of the joint. Reduce in the joint space. Later, the joint space it is reduced due to the fluid loss in the joint and destruction of the cartilage causing the crepitus. Next, muscle weakness and atrophy of the joint range of motion. It is limited can lead to a joint malalignment of the weight-bearing joints. There may be a capsular pattern are present in the osteoarthritis, flexion and extension. By looking for the sensory, it may be affected the kinesthesia and proprioception. Deformity. In later of stage, it might be get deformed like genu varum and flex deformity. No specific systemic symptoms are seen in with the osteoarthritis. Haber's nodes are seen in the osteoarthritis, the small joints. Now looking for the gait it is particularly it is a waddling gait or antalgic gait are seen. This is all about the clinical presentation of the osteoarthritis. Thank you for watching.